Um, Dr. Kaplan, sometimes parents bring a child to a cardiologist and they're told they have to give antibiotics before they see a dentist or some surgical procedures. Why is that happening?
With some heart problems, some heart defects, you have abnormalities where infections can occur, where bacteria could actually hook on to the abnormal part of the heart.
And what does the antibiotic do?
What the antibiotic will do is it'll decrease the risk of getting an infection in the heart itself. It'll actually kill the bacteria.
If you don't take the antibiotic, what can happen?
If you don't take it, you're running the risk of getting an infection at the abnormal portion of the heart.
And that will cause?
Well, it can cause a very serious infection. Certainly any infection in the heart could be deadly. The heart could go into failure and the patient could die.
So if a patient is told to take this antibiotic, it behooves you to be very diligent in doing that.
Oh,
what
absolutely.
Antibiotics do they usually use?
The most common one that we use is some form of a penicillin, usually amoxicillin. Sometimes patients are allergic to amoxicillin, so they'll often be given clindamycin instead. Also, depending upon the procedure, you might even need 2 antibiotics. Often those are procedures which are done on the lower on the urinary tract.
If a child takes these antibiotics, does that guarantee you don't get a problem?
Does not guarantee it. It only lowers the risk much more. We actually rarely see endocarditis today. We used to see it much more before the antibiotic era.
Use this term endocarditis. That means?
Endocarditis means an inflammation of the heart, or of the heart muscle. And it means, when you would get an infection, it will give you then an inflammation of the heart. So it's kind of a general term.
So the rule of thumb is, this is a discussion. You always should take that with your pediatrician and make sure that you are comfortable what you should be doing in a situation where there has been told that you would need a thing called SBE, prophylaxis. Is that correct?
Right, right.